What comes to mind when you hear the term bupropion? A common antidepressant? A smoking cessation aid? Or perhaps a weight loss medication? Today we will debunk the common misconceptions about bupropion. Bupropion, more commonly known as Wellbutrin, is a versatile medication that's often misunderstood. You might be surprised to learn that it's not just a one-trick pony in the world of psychiatric medication. Beyond its established use in treating depression, bupropion has a host of other applications that make it stand out from the crowd. From helping individuals quit smoking to potentially aiding in weight loss, bupropion's uses extend far beyond just lifting spirits. It's even been used to address sexual dysfunction and as an adjunctive treatment with other antidepressants and mood stabilizers. So it's time to set aside any preconceived notions you might have about this drug. So buckle up as we delve into the world of bupropion, a drug that is far more than just an antidepressant. Bupropion, marketed as Wellbutrin among other brand names, is a unique antidepressant both in its structure and in its pharmacological profile. Now let's dive into what makes bupropion so special. Bupropion's chemical structure is distinct, most notably because it does not fit neatly into any of the established classes of antidepressants. Unlike selective serotonin reuptake inhibitors, or SSRIs, and serotonin and norepinephrine reuptake inhibitors, or SNRIs, bupropion doesn't primarily target serotonin or norepinephrine. Instead, it's classified as a norepinephrine dopamine reuptake inhibitor, or NDRI. This means it works by increasing the levels of these two neurotransmitters in the brain. But it's not just about the neurotransmitters it targets, it's also about the ones it doesn't. Bupropion has minimal effects on the serotonin system, which differentiates it from many other antidepressants that often lead to side effects like weight gain and sexual dysfunction due to their impact on serotonin. In addition to its unique mechanism of action, bupropion also stands out in its pharmacological profile. It's metabolized in the liver, primarily by the CYP2B6 enzyme, and has a half-life of approximately 20 hours, which allows for once or twice daily dosing. It's also worth noting that bupropion has a relatively low risk of drug interactions, making it a safer choice for patients who are on other medications. Another key feature of bupropion is its stimulant-like properties. These properties can lead to increased energy and alertness, which can be beneficial for patients with depression who experience fatigue or low energy. However, these same properties can also lead to an increased risk of seizures, which is why bupropion is generally avoided in individuals with a history of seizures or eating disorders. As we can see, bupropion's unique properties make it a standout in the field of psychiatric medications. Now that we understand what bupropion is, it's time to take a look at its wide range of uses. Primarily, bupropion is an antidepressant, and it's one of the most widely prescribed medications for treating depression. It works by inhibiting the reuptake of dopamine and norepinephrine, thereby increasing their concentrations in the brain. This helps to elevate mood and counter depressive symptoms. But bupropion doesn't stop there. It has also proven to be a potent ally in the fight against nicotine addiction. Bupropion is regularly prescribed as a smoking cessation aid, helping to reduce cravings and withdrawal symptoms in those looking to quit. It's been shown to be almost as effective as nicotine replacement therapy in helping smokers kick the habit. Moreover, bupropion is unique among antidepressants for its potential to aid in weight loss. While many antidepressants are associated with weight gain, bupropion has been observed to have the opposite effect, making it an appealing option for individuals who are concerned about weight gain from their medication. And then, there's the issue of sexual dysfunction, a common complaint among patients on various types of antidepressants. Bupropion stands out in this regard as well. It's been found to have a lower rate of sexual side effects compared to many other antidepressants. In some cases, it's even been used to treat sexual dysfunction itself. Lastly, bupropion is often used adjunctively with other antidepressants and mood stabilizers. This means it's used in combination with these other medications to enhance their effects or to alleviate some of the side effects they may cause. As we can see, bupropion's uses extend far beyond its primary usage as an antidepressant. Bupropion's wide range of applications and its unique profile among antidepressants make it a versatile tool in the arsenal of psychiatric medications. From treating depression to helping people quit smoking, aiding in weight loss, mitigating sexual dysfunction, and enhancing the effects of other medications, bupropion truly is a multi-use psychiatric medication. With any medication, understanding the potential side effects is crucial. So, what can one expect when taking bupropion? As we delve into the side effects of bupropion, It's important to note that not everyone who takes this medication will experience them. However, being aware of what could occur allows for a more informed conversation with your healthcare provider. Let's start with the common side effects. These may include dry mouth, sweating, shakiness, nausea or vomiting, weight loss, or a feeling of constant restlessness. Most of these are mild and often subside as your body adjusts to the medication. Next, we have the less common side effects. These can include skin rash, increased heart rate, high blood pressure, and blurred vision. While less common, these side effects are more serious and should be reported to your healthcare provider immediately should they occur. Lastly, there are the rare but severe side effects. These include hallucinations, severe allergic reactions, and unusual changes in behavior or mood, such as extreme agitation or a sense of impending doom. It's also worth mentioning that bupropion carries a black box warning for increased risk of suicidal thoughts and behaviors in children, adolescents, and young adults. If you or someone you know who is taking bupropion experiences these side effects, it's essential to seek medical attention immediately. Now, it's important to remember that everyone's body responds differently to medication. Some individuals might experience several side effects, while others might experience none at all. Additionally, the severity and duration of side effects can also vary significantly among individuals. Moreover, side effects shouldn't discourage you from considering bupropion as a treatment option. In many cases, the benefits of this medication, such as its effectiveness in treating depression and aiding in smoking cessation, often outweigh the potential side effects. In conclusion, while bupropion does have its side effects, they are manageable in most cases and should not deter you from considering this medication if it's been recommended by your healthcare provider. Although it has its side effects, bupropion's benefits often outweigh these, making it a valuable medication in the psychiatric field. For healthcare professionals preparing for board exams, understanding bupropion is essential. So, let's delve into the importance of bupropion in the context of board exams. As a medication that's commonly prescribed for a range of conditions, questions about bupropion are likely to pop up in your exams. Therefore, a solid understanding of this drug is not only vital for your professional practice, but also for acing those tests. One of the key points that's often tested is bupropion's mechanism of action. Remember, it primarily works by inhibiting the reuptake of norepinephrine and dopamine in the brain. This distinctive mode of action sets it apart from other antidepressants, making it a critical point to remember. Its diverse uses are another area that's frequently examined. Bupropion is not only used for treating depression, but it's also prescribed for smoking cessation, weight loss, and sexual dysfunction. Moreover, it's often used adjunctively with other antidepressants and mood stabilizers. This wide-ranging application of bupropion underscores its versatility and the need to understand it thoroughly for board exams. Side effects of bupropion are also a key focus area. It's essential to understand that while bupropion has a lower risk of sexual side effects compared to other antidepressants, it does carry a risk of seizures, dry mouth, and insomnia, among other effects. Understanding these potential side effects can help in making informed decisions when prescribing this medication. Lastly, it's crucial to understand the contraindications of bupropion. It should not be prescribed to patients with a history of seizures or eating disorders, as it can exacerbate these conditions. Also, it's important to be aware of potential drug interactions, especially with monoamine oxidase inhibitors. As we delve deeper into the complexities of bupropion, it becomes clear that it's not just another medication. Its unique properties and wide-ranging applications make it a key topic for board exams. As we wrap up, it's clear that bupropion is a multifaceted medication that offers benefits for a range of conditions. Its understanding is not just beneficial for patient care, but also for acing those board exams. So, we've journeyed through the key concepts, uses, and side effects of bupropion. We've discovered its role as a potent antidepressant and how it's uniquely equipped to tackle smoking cessation. We've explored how it can aid in weight loss and help manage sexual dysfunction, a common issue with many antidepressants. We've also delved into the potential side effects, understanding the risk factors and how to mitigate them. Moreover, we've looked at how bupropion can be used adjunctively with other antidepressants and mood stabilizers, providing a versatile tool in the treatment of mental health disorders. And as we prepare for board exams, we've learned how vital an understanding of bupropion is, both theoretically and practically. By understanding bupropion, we can better serve our patients and enhance our own knowledge. Stay curious, stay informed, and keep exploring the fascinating world of psychiatric medications.